Let's talk about motion sickness and visual dependency. When people have motion sickness, some people can describe it as a feeling of dizziness, but for the most part, people with motion sickness have this very distinct feeling that sitting in a car or being in a moving vehicle, or even if they're so sensitive that just movement of their body actually makes them feel a little bit nauseated. It feels like they might have a pressure in their head, they might have pressure in their eyes, and this feeling causes them to feel very sick and also very sensitive towards any types of movement. In order to understand motion sickness, one of the big drivers of motion sickness is something called visual dependency. One of the prevailing theories about visual dependency and motion sickness involves the imbalance of three big sensory systems in your body. The first one is your vision, so your vision can detect motion in the environment. The second one is your vestibular system. So your vestibular system are the organs in your inner ear that help detect when your head is moving. And the third system is your proprioceptive system, which are the sensors that come from movement of your joints or muscles. In a normal human being, you have a distribution of these senses that relies heavily on your proprioceptive system for balance and your visual system and your vestibular system. When people have a vestibular issue or they have a proprioceptive issue, then sometimes they could go through a process where they start to become very, very reliant on their sense of vision. And when people become over-reliant on their sense of vision, then they detect motion with their eyes, their body will actually feel like it's moving. And this becomes super problematic because our brains are already super wired to make vision a priority for us. But if we're adding more prioritization using that visual system, then suddenly seeing a moving car in your peripheral vision suddenly gives you the sensation that your body is moving. And when that happens, you have something that's called a sensory mismatch occurring, meaning that your visual system says the world is moving around you, but your vestibular system and your proprioceptive system says, no, I'm standing still. And when you have these senses that are clashing, if those senses clash enough, then your brain has to decide what is the sense that I should trust more. And if it starts to trust on your visual sense more, then it creates this sensory error where your brain thinks that it's moving when it's not really moving. So how do we identify visual dependency in people? We have a couple ways that we do that. One of the big ways that we do that is we use this striped type of tape or flag called an optokinetic tape. Basically, we have people follow this movement with their eyes, and we track how their eyes are following the motion of that tape. And we also detect if there's any problems with the eye movement itself, or if just looking at that causes some of these symptoms to occur in of itself. The other way that we can test this is we'll actually do a balance test where we put your feet together or you're standing on a balance pad, and we'll test the person's balance when they have their eyes open with nothing to look at. We'll have them test it with their eyes closed so they can't see anything. And sometimes we'll actually have them stand on the foam pad, and then we'll actually wave this optokinetic flag in front of them and see if that disorients them or throws their balance off in any meaningful ways. This is something that is highly prevalent in people with things like vestibular migraine. It's also really highly prevalent in people with motion sickness in general. And one of the key aspects to rehabilitating motion sickness is we'll actually start to change the way that they distribute that sensory information. So if we know that they're visually dependent, then we'll try to shift our rehab towards making them more dependent on other systems like the vestibular system or the proprioceptive system. And one easy way to do that is by having them do rehabilitation exercises with their eyes closed so that they can't use the visual system in order to figure out what's going on. Now, when it comes to doing this rehab, it can be very stressful on a motion sickness patient because we have to kind of find that line between we want them to move their body and detect movement, but not so much that it's greatly exacerbating their symptoms. So we have to find this level where we're slightly increasing their motion sickness without actually putting them over the edge where they're going to be sick or become super symptomatic. And that's a big part of what we do when we're assessing or treating these patients is we're always monitoring how is their autonomic nervous system responding to the treatment. So we'll look at things like their pulse oximetry, we'll look at their pupils, we'll look and monitor how much their palms start sweating. And if we see we're doing too much to the nervous system at any given time, then we'll start to back our therapies off. If we see that they're tolerating it well, then we'll keep pushing them until they can start to handle the normal range of stimulation that a normal human being will feel without it causing any motion sickness symptoms. And over time, we've had a pretty good amount of success in being able to get people to not feel severe motion sickness when they're just going through their day-to-day activities. And the big part and big wins for us are when people could actually drive and they don't feel motion sick anymore. And some people will talk about they could sit in the passenger seat of their car and the movement of the background and the windows aren't throwing them off anymore or disorienting them. If we've done a really good job, some people, if they want to go onto a boat or roller coaster again, they could actually start to go onto a boat or roller coaster again because their motion sickness symptoms aren't agitated. So I hope that gives you a little bit of information about what might be driving your motion sickness symptoms. If you have any questions, feel free to reach out to us through social media at Keystone Neuro on Instagram, at Keystone Neuro on Twitter. Happy to interact with you, and keep following this YouTube page or this Instagram page for more information and more videos like this in the future.